My name is Poppy. I'll be doing a head-to-toe assessment on you today. May I have your name?
Rajiv Das,
And what is your date of birth?
9/26/59.
Okay, let me just wash my hands. Okay, so what brings you in today?
A physical exam.
Okay, so do you know where you are today?
Yes, I'm in Kolkata, India,
Okay, and who is the president
of the United States.
of the
Don-
United States?
Donald Trump.
Okay, so we have a male patient who is 59 years old, awake, alert, oriented times 4, and he appears to be pleasant, well groomed, and so I'm going to be basically doing an assessment on you. I'll be touching parts of your body, so you please let me know, and you might, we're going to have you change your gowns, and I'm going to give you a cup so you can go urinate at this time. Okay, so you're going to go do all that, and you've changed into your gown. So now I am going to take your vital signs, which we already took in the thing of to save time. Your temperature is 97.8. The blood pressure is 120/76. Heart rate is 82. Respiratory rate is 76. Oxygen saturation is 99. And are you in any pain right now? Okay. So I'm going to begin with assessment of your head. So I'm just going to palpate. So is it okay if I touch? Okay.
Sure.
So I'm going to palpate. Hair, head is normal cephalic. Hair is evenly distributed. No lumps or bumps noted. Okay. So and then the skin appears to be normal for ethnicity. No bumps, no bruises, and no edema noted at this time. Okay, so then I'm going to look at your face, and the skin over your the face looks even. Face is oval in shape, and skin color is normal. And may I take the temperature of your skin? Okay, and the turgor is good too. So for your can you do these measures for me? Can you close your eyes real tight, move your eyebrows up, smile, frown, puff your cheeks. Okay, that sounds good. Okay, so now I'm going to facial asymmetry is there. There's no drooping, and all the cranial nerves are functioning. So I'm going to look at your eyes now, right? Okay, so the eyebrows look to be uniformly spread, and lashes are turned upwards. So let me just feel your lacrimal glands right now. Okay, so there's no drainage. The eyelids are covering the pupil. Can I look at your cornea for a minute? Okay, that looks good. It looks moist and red. And I am going to now ask you to follow this pin light for me. Okay, so here it is. I want you to follow it. Don't move your head. Okay? Okay. So now I'm going to put it closer to your nose. Follow that right there. Okay. So we're going to, since we don't have ophthalmoscope, we're going to continue to use this. So I'm going to use a flashlight. There's going to be a light coming towards you. Don't move your head. So this is a light that is on. So that pupil is reacting. So pupils are equal and reactive to light and accommodation. Okay, so now we're going to move on to check your nose. Okay, so nose looks to be symmetric. No septal deviation noted at this time. So I'm going to put a flashlight, and I'm going to just look up into your nose. Okay. Sinuses are illuminated, and then there is no polyps, and or nasal mucosa looks to be moist and warm. I'm going to press on this one side. Go ahead and take a deep breath in and out. Now press on this side. Go ahead and take a deep breath in and out. That looks to be good. And then I'm going to have you close your nose, smell. What do you smell?
Coffee.
Close your nose again and smell. What do you smell?
Coffee.
Coffee. Okay, good job there. Okay. another thing we have to do for your face is I'm going to touch your face with a cotton ball, Q-tip. Let me know where you feel it, okay? Do you feel it?
Yes. 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 Yes.
And then, what? Okay, so I'm just going to check your corneal reflexes at this time. So I'm going to gently touch your cornea with this and look for a reflex, okay? Okay, so now I'm going to look at your mouth, okay? The lips seem to be symmetrical, no drooping noted. And then you have, may I have you open your mouth for me? Okay, all the teeth are present, a couple of fillings are there, buccal mucosa is red and moist, and go ahead and stick your tongue out for me. Tongue looks to be red with taste buds on it. I'm going to push against this, push against the thing, and then again here, lift your tongue up. So here, there's no lesions. And then I'm going to look at the roof of your mouth. The hard palate looks red and moist. Okay, stick your tongue out. I can see the uvula and it's on the midline. No tonsillar inflammations noted. Okay, so now I'm going to take a look. Oh, I'm going to check for your gag reflex. 1 second. Okay, so now I'm going to look at your ears, okay? So as far as the ears, I'm inspecting both the ears. So the tragus, the auricle, and the lobar area, there's no redness, there's no discharge noted at this time. Although I don't have an otoscope, I'm going to make an attempt to look into the ear canal. I'm going to lift the ear up and back, and I'm going to look through, right? So the tympanic membrane looks pearly and white, and no cerebrum is noted. Same thing I'm going to do this year. Look through, no. So the tympanic membrane looks pearly white, and so no cerebrum noted. So I'm going to check for the temporomandibular, the temporal arteries, and they're there. And then I'm going to have you open your mouth and close. I'm checking the TMJ, no crepitus noted, and I'm going to check the mastoid process. So as far as the hearing goes, if I had, if I had the right equipment, do a Winnie and a Weber and Winnie test. But since I don't have that, I'm going to occlude one of the ears and whisper a word and have it repeated. Okay, so that looks good right now. So also at this point, I'm going to check for, look at your neck right now. So on inspection, the neck does not seem to have any swellings or lumps. Skin seems to be normal. Trachea seems to be in normal place. So I can palpate to check for tracheal deviation and none noted at this time. So I'm going to palpate some of the nodes for you. These are preauricular, posterior auricular, occipital in the back, submandibular, submental, and these are the ones on the sides, the supraclavicular and infraclavicular. I'm also feeling for the thyroid gland. Can you swallow for me? So the thyroid gland does not appear to be enlarged. So can you show me a range of motion with your head? You can put your head forward and backward, to the right and to the left. And then I want you to push against my hands with this. And there you go with that. Okie dokie. So now we are going to have you lie down and just lean back in 45 and turn your head to the right. So no jugular distension noted on this side and no jugular distension noted on this side. Also, I'm going to feel for your carotid pulses. I cannot do both of them at one time. So I check on one outlet. Pulses are strong, 2+. I will listen to it with the bell of my stethoscope. Good. Good job. Okay, So now, sir, please let me look at your hands. Could you spread your hands out for me at this time? So, capillary field is 2 plus. Fingers have good range of motion. Go ahead and move your wrist around for me. Okay, so I'm going to feel for your pulses. These are your brachial pulses that are strong 2 plus. Radial pulses strong and 2 plus. Skin appears to be normal. No bumps or lesions noted at this time. Okay, can you show me range of motion of your elbows? Let me see. No crepitus noted. No crepitus noted. Okay, squeeze your hands for me real tight. And then I want you to push against my hands. There we go. Okay, good job. Thank you so much. So now, if you will kindly stand up, and I will have you turn around. Take your shirt off for me, sir. Okay, let's take a look at posterior scapula. So I look at the back side, and then there does not seem to be any use of accessory muscles. So I'm going to align my fingers at 10, 9, and 10. Take a deep breath in. That's good. And then I'm going to palpate and then I'm going to percuss. Okay, turn around for me again and stand to the side. I'm looking for the diameter. The diameter of the chest is normal. There's no barrel-shaped chest noted. I'm looking at the anterior, and here also there's no labored breathing. Take a deep breath in and let it out. So now I'm going to take a listen to your lungs. Oh wait, let me feel for it. So no hollowness noted. I'm sorry, I have to listen to the back side as well. So lung sounds are clear on all lobes. No adventitious lung sounds noted. So now I'm going to look at the chest and do the assessment for the heart. So I'm going to listen. I'm going to palpate. Do you have any pain or anything here? Along here? No. Okay. So, no. And so let me take a listen. So I'm starting at aortic. Take a deep breath in. No, just breathe normally. So aortic, pulmonary, Erb's point, tricuspid, and apex. So all S2 and S3 heard, no murmurs noted at this time. Okay, so now I'm going to have you lie down on your left side, and I'm going to listen for the apex of the lung. Okay, at this time I'm going to have you turn over so I can look at your abdomen. Okay, so the abdomen looks round, but it's soft and non-distended. So I'm going to palpate, I'm going to auscultate for bowel sound. Do you have regular bowel movements, sir?
Yes.
Good. Okay, so I'm going to listen for bowel sounds in all 4 quadrants for a minute. Bowel sounds are active. Okay, and then I'm going to palpate and then I'm going to do some deep palpation to see if your liver is enlarged and the aortic, and then I'm going to listen for the aortic pulses, the renal pulses, and the iliac pulses. Okay. So at this time, I'm going to take a look at your legs, sir, and I'm going to see for the distribution of the hair on your legs. Hair is evenly distributed, and legs seem to be well moisturized. So I'm going to feel for the pulses here. Popliteal pulse, pedal pulses are 2+ and strong. Tibial, again here, popliteal, pedal, and tibial pulses, and there's no edema noted at all. Okay, if you would like to stand up, we can have you walk back and forth for me. Back and come back, and then good. Your gait is good. Then you're going to do one foot in front of the other, and I can support you if you like. There we go. Oh, that's really good. Okay, now I want you to turn around, and I want you to close your eyes and fold your arms. Okay, so this is Robert negative because he's not falling over. So at this time, I would like to assess you for genital exam. So we will go ahead and check for that. So if you would like that, and we would also like
I
to.
refuse to.
Okay, and also we would like to do a rectal
I
exam.
refuse.
Okay, all right. Well, if you have any other questions, please let me know if I can be of any help.
Thank you.